Catherine Young, Chair of the Senate Finance Committee. Pursuant to the state constitution and legislative law, the fiscal committees of the state legislature are authorized to hold hearings on the executive budget proposal. Today's hearing will be limited to a discussion of the governor's proposed budget for human services. Following each presentation, there will be some time allowed for questions from the chairs of the fiscal committees and other legislators. I would like to welcome Sheila J. Poole, Acting Commissioner of the New York State Office of Children and Family Services. Testifying on behalf of New York State Office of Temporary and Disability Assistance, Commissioner Samuel D. Roberts. We will have James S. Rubin, Commissioner of the New York State Division of Housing and Community Renewal. Sharon Devine, Executive Deputy Commissioner of the New York State Office of Temporary and Disability Assistance, OTDA. Linda Glassman, OTDA Deputy Commissioner. Krista Rock, OTDA General Counsel, and Corinda Crossdale, Director of the New York State Office for the Aging. We are joined today by my colleagues from the Senate. We have Senator Liz Krueger, who is Ranking Member on the Senate Finance Committee. We have Senator David Carlucci, who is Chair of the Social Services Committee. We've been joined by Senator Diane Savino and Senator Phil Boyle. And at this point, I'd like to turn things over to my colleague, Chairman Denny Farrell from the Assembly.
All right, thank you, Senator. We've been joined by Assemblywoman Jaffe, Assemblyman Simbowitz, Assemblywoman Lepardo, and Assemblyman Hevesy. They are each chairpeople of the Social Services of CNF and Veterans Affairs and Aging Committee. And Mr. Oakes will give you his name.
Yes, and we've also been joined by Assemblyman Goodell.
Thank you. At this time, I'd like to begin with the testimony of Sheila Poole, who is Acting Commissioner of the Office of Children and Family Services. Welcome and good morning.
Good morning.
We look forward to your testimony today.
Thank you, Senator, and it's good to be here with all of you today. Chairwoman Young, Chairman Farrell, Senate Children and Families Committee Chair Avella, Assembly Children and Families Committee Lepardo, and distinguished members of the Senate and Assembly. My name is Sheila Poole, and I'm the Acting Commissioner of the Office of Children and Family Services. This year's executive budget reaffirms the governor's commitment to a balanced and fiscally responsible budget that strongly supports OCFS's core mission. As an agency dedicated to serving the children, youth, and families in New York State, OCFS oversees a wide range of programs and services in the critically important areas of child welfare and community services, child care, and juvenile justice. The proposed executive budget maintains vital agency funding at last year's level while making investments in key initiatives that will benefit all of the populations that OCFS serves. One example of that funding is for child welfare services. The executive budget recommends $635 million to continue supporting child welfare services, renewing New York State's commitment to 62% state reimbursement. Supplementing other available funds, these dollars support a host of child protective, child preventive, aftercare, independent living, and adoption services. New York is a national leader in providing robust funding for these efforts, which make a difference in the lives of thousands of New York State's children and families. This investment supports the critical work of our local social service districts. It also funds the essential programs and services provided by our child welfare partners and community-based agencies throughout the state. The executive budget proposal includes $445.5 million in foster care block grant funding, which supports foster care services, including kinship programs. Local districts continue to have the ability to reinvest any unused portions in the next fiscal year, which can be used to support locally designed child welfare initiatives that strengthen preventive services and better serve high-needs children who can benefit from independent living or aftercare services. The proposed budget also includes an additional $4.5 million in funding to support programs that serve this population under the Runaway and Homeless Youth Act. The governor's budget proposal includes authority to invest adoption assistance savings of $5 million into preventive services and other post-adoption services as required by federal law for children at risk of entering foster care. OCFS plans to use these funds to support the development of permanency resource centers to provide post-adoptive and kinship support to families. The executive budget continues a critical investment in the child care subsidy program for 2016-17 at almost $800 million. These funds enable low-income working families to access affordable child care and to support New York State's child care providers. A $5 million investment in the Quality Stars New York program would support the implementation of a quality rating and improvement system to provide high-quality early learning programs and enable the state to mandate participation for low-quality programs as a condition of receiving state funding. This year's budget proposal also reflects the governor's continuing commitment to raising the age of criminal responsibility in New York State from the age of 16 to 18. New York State took a bold step forward in December with the executive order that will remove most minors from adult prison and house them in age-appropriate correctional facilities with specialized programs offering them a better chance to turn their lives around and to find a brighter future. While the executive order is an important step and OCFS strongly supports this action, it does not, however, raise the age. The reasons to raise the age are many. We know that when troubled youth are sent to adult prison, it sets the stage for a life of violence, recidivism, with little prospect for the rehabilitation that would prepare them to return to their communities as productive and responsible adults. Removing young people from the adult criminal system will improve outcomes and make a vast difference in the lives of these 16 and 17-year-olds. Additionally, the executive budget proposal increases funding for our Human Services call center by $600,000 to a total of $14.1 million. This call center was established upon recommendation of the SAGE Commission and now answers more than 30 telephone lines for 10 state agencies. And we anticipate a call volume of 1.2 million calls in the coming year. I thank you for the opportunity to address you today, and I welcome your questions and comments. Thank you.
Thank you very much. Our first senator up will be Senator David Carlucci. And before he begins, I do want to mention that we've been joined by Senator Daniel Squadron and Senator Roxanne Persaud. Senator?
Thank you, Chairwoman Young, and thank you, Acting Commissioner Poole, for your testimony, and particularly for addressing Raise the Age. And I just had further questions about the executive order that was done in December, and if you could talk a little bit about how that has evolved in terms of placing our 16 to 18-year-olds in age-appropriate settings. Are there places for them? Have we started to move them? How far do we have to go? If you could address that.
Certainly. I would just clarify that that executive order really directed the Department of Correctional Service to undertake those activities, but because we are working in partnership with DOCS, I feel like I can provide a good answer for you. So DOCS is currently working to renovate an existing DOCS facility to serve as the place for the 16 and 17-year-olds to be moved out. I believe the plan is for that to be accomplished by September of 2016. I can also report, Senator, that as part of the executive order, the governor asked OCFS to work closely with DOCS to provide assistance in mental health consultation, any curriculum or training that we have at OCFS, given our work with juveniles. And so we're providing support and consultation to DOCS as they create the new model for these youth in that facility.
So just to clarify, until we have a legislative change, the custody of these children will be under DOCS and not OCFS.
That's correct. For those currently incarcerated 16 and 17-year-olds who are in DOCS, they remain in DOCS custody. Okay,
and if we were to change the law, are there adequate places for these children? in New York State right now? Do we have a lot of work to do to get up and ready and build these facilities? Is there room?
Yes. The answer to that, Senator, is yes. Certainly within the OCFS footprint of juvenile justice facilities, we do have capacity in a number of our facilities to accept youth. Under the current Raise the Age proposal, the majority of newly sentenced 16 and 17-year-olds would come to OCFS's secure levels of service. And so I think we can work to create that capacity in relatively short order. As I said, giving our existing footprint, I think we could make that possible.
So right now, 16, 17-year-olds that are under the custody of docs are in our state correctional facilities. They are being isolated from general population. And have you worked with docs to know a number of, are there still these children in general population?
I couldn't answer that question, Senator.
Okay. And then just to talk about child care, you know, one of the things that is so important is accessible, affordable, quality child care here in New York State. And we hear story after story about how it's out of reach for most families in New York State, just the affordability option, and they're left with subpar options. What is your agency doing to make sure that there is affordable child care, that there's safe child care, and to another level that there's transparency, that we know as a parent, when I drop my child off at daycare, that I know if there's a violation, that I know what's going on, and how my daycare ranks as opposed to other daycares, and what would be a model daycare. You know, how does a parent know that? Sure. How can we work towards that end?
Sure. So to answer the first part of your question, the executive budget provides almost $800 million to provide subsidy support for those families, as you said, need assistance in accessing safe and quality care. And that's a commitment that this administration has sustained for a number of years, despite, in fact, a diminishing investment on the part of the federal government. There's always a need for more, without question. At OCFS, we also do a lot and have done in partnership with our unions, UFT, CSEA, our child care resource and referral agencies that we also fund to really be in the communities, supporting providers, providing training to further professionalize the child care workforce, so that not only are we creating access, but that we're building quality, improving child development, understanding of development well-being, safety for children, safe sleeping, all those kinds of things that can help create a safer child care environment. So I think we've made some good progress, some good investments, and certainly the Federal Child Care Development Act that I'm sure we'll talk about soon calls for even additional kinds of training qualifications. As to your last question, Senator, OCFS's website, I don't know if you've ever had the opportunity to go, but you are a parent. It's really aimed for parents seeking child care so that they can do just what you described. How do I know if a child care that I'm considering first of all, is licensed or registered with the state, so you can go and plug in Sheila Poole's Child Care Center, and if it's registered or licensed by the state, that will pop up, and you will be able to search the enforcement history along with any violations or enforcement actions that we have taken. We also strongly encourage you to contact one of our child care resource and referral agencies, again, as a navigator to help families. And we also field a lot of calls at our OCFS regional office. Those are our licensors, our frontline staff who are licensing, who know these providers the best out in the community. So I think we try and do that. You know, as you are probably aware, child care centers in New York City are currently under the purview of New York City only, and so we also want to make sure that if families happen to come to the OCFS website seeking care, that there is a large prominent note making sure that folks understand that some of that care is also in New York City, and they click on a link and it can take them to New York City's website, which also is very transparent in terms of a provider's enforcement history.
my colleagues and I in the Independent Democratic Conference have been working towards legislation to have a letter grade system for daycares, similar to the restaurants. Is that something that OCFS would be in favor of, supports?
You know, I think we're always interested in any conversations to be had about collectively trying to raise the quality of care and certainly making sure that any parent who's seeking care, I mean, that's one of the most important decisions you ever make as a parent, right, is a fully informed one. So we'd be happy to engage in any conversations.
And then just one last point. We talked about the child care subsidies, extremely important, and we've got to make sure that parents can put their children in the appropriate places. What are we doing to address the issue of middle-class families that are not qualifying for the subsidies and are just out of reach of that and are paying the full price? Many cases, I know in Rockland and Westchester, on average, it's $1,500 a month per child. For middle-class families that are out of reach for the subsidy, that's a big, big bill to pay. You know, you can take out a loan for college, you can't take out a loan for daycare. What do we do to address that issue for middle-class families?
You know, I think the best answer to that is that local departments of social services who administer, you know, the child care allocations, including the subsidies that the state sends down to them, I think do their very best, Senator, within their means to try and balance, you know, creating access for new families seeking care, the working poor, folks looking to return to work, with also maintaining caseloads and continuing subsidy or other, you know, parts of support for the working families. But again, it's really a function of the available funds to local districts and the fluidity of their child care caseload.
Well, even so, I mean, that money wouldn't flow over to these middle-class families. They would not be eligible for it. No. So this is an issue where we have these silos, right? We've got Office of Children and Families over here. We've got Taxation and Finance over here. Maybe that's something where we could use your experience, your expertise to really lobby other agencies to say, hey, maybe we should increase the dependent care tax credit, and strategies like that. That would be very helpful to say, hey, you know we have our function and role, but there are other things that relate to the Office of Children and Family Services, and that's something I'd really implore you to do, to use your expertise to try to help say, hey, what can we do to use the synergy of our enormous government to work together towards addressing these issues as so important as child care. So thank you so much for answering my questions. I really appreciate it.
You're welcome, Senator. Thank you.
Thank you. Assemblyman?
We will have the next person to question will be Assemblywoman Lepardo, who is the chair of the Children and Families Committee.
Thank you. Good morning, Commissioner. It's nice to have you here. I'm going to spend the bulk of my time talking about the implementation of the Child Care and Development Block Grant, which, from our point of view, looks like a very large, unfunded federal mandate. And, you know, while additional site inspections, background checks, new background checks on some 220,000 providers, new training professional development requirements, and a whole new approach to parental eligibility is welcome. And I think many of the advocates welcome that improvement in the system. Estimates are very troubling as to what that would cost, upwards of $90 million just for the first three items that I mentioned, and an unknown amount for the parent eligibility. So if you wouldn't mind, maybe we could go through step by step some of those areas, and we can sort of compare notes and see what you have in mind. The first one has to do with training and development. That needs to be completed, our understanding is, by September 2016, and budget estimates are about $20 million. Do you have any additional information on that, whether or not we already have something in place that would be eligible for that, or whether we're doing something new?
Thank you, Assemblywoman. Great questions. So if I could just for a minute, because I think there's a lot of questions about the implementation of this act, I think just to kind of set a contextual stage a bit. So the act was passed and signed by President Obama in November of 2014. And of course, at that time, we saw the implications, as has every other state, in terms of the magnitude, Assemblywoman, that you just pointed out, without any federal money coming to help states try to address the implementation of this. We've been advocating really since the passage of the bill through our governor's D.C. office, through all the advocacy groups that we belong to at OCFS, really expressing to the federal government just what you said, Assemblywoman, that on its face, who can argue, right, with increasing quality? Who can argue with enhanced training, all those kinds of things? But for the federal government to expect states like New York, who already make such a deep investment in subsidy, to really find a way to fund all of these new requirements is really problematic. On top of that, the federal government waited until December of 2015 to issue their draft regulations. And all of us who are now looking at those draft regulations across the country are further alarmed that those regulations actually seem to go far beyond what the initial statute said. So that public comment period is open right now. It will close on February 22nd. And we are putting together our comments. We're imploring all of our partners, including all of you, to be a strong and loud voice on behalf of our families in New York State, that without additional federal funding, states are really left with either requesting extensions for some of the provisions until we really understand what the final federal regulations will come out and look like, or that we continue to advocate for more money. You know, the worst possible scenario, which is one that many states are facing, to comply with the federal requirements, absent any additional federal funding, you're looking at decreasing your subsidies, right? Moving your state's investment in subsidies, which we all know is key for our families, and using it to try and support some of the unfunded mandates of this act. So the final part of your question, though, Assemblywoman, is as we're looking at the proposed act as well as the regulations, we're also making a careful list of the things we currently do in New York State. And so you all know we're one of the most regulated states in child care in the country as it is now. And so we do a lot of pre-qualification. We do a lot of clearances for interested providers, in-state clearances, SCR clearances. We check providers against the Justice Center staff inclusion list. We don't do the national checks that are called for in the act, but in fact we do a lot in our state, and so we're trying to make that case where we can to prove that we do have that capacity. Again, Assemblywoman, we don't have a sense whether or not the federal government is going to recognize, those efforts.
So we seem to be in a little bit of a time frame collision. And our concern is that if we don't get this right or understand the implications, we're going to drive providers underground, risk losing subsidies, as you mentioned. We're going to lower quality. And I mean, we already have a fragile system, and this is going to threaten and risk it even further. So can you walk us through that one more time? We're hoping the federal government will come to the rescue, but in the meantime, are we at least planning to be, out in front of this to avoid calamity in the long run? Yeah.
Yes, Senator or Assemblywoman, we have been out in front of it. I mean, we continue to, and especially now that the draft regulations are out there, I think states have been put in a really untenable position trying to implement, an act with so many moving parts, all of which cost so much money. Not many of them are one-time expenses or non-reoccurring. When you're in to this, you're in for the long haul. So I want to assure you and all the members here that we are advocating very strongly. I think, frankly, it's going to take a broader voice, including our legislature, to really help say we cannot afford to do this. And the other fact of the matter is that our administration, with support of all of you, have invested a lot of money in daycare. We have almost $800 million in the budget. We have other quality initiatives. And so it's a real challenge for us, Assemblywoman.
So you did put $10 million, or I'm sorry, the governor put $10 million in the budget toward one of the components of this. So again, just so I understand we're all on the same track, our hope is to either get an extension, to appeal to the federal government to help pay for this. But by April 1st, we have to have a budget that at least has some additional resources put toward this, if need be. I can't imagine we're going to be able to pull this off with just $10 million. Would you agree with that?
I think it's going to be very challenging, absent additional federal money, for us to pull off the requirements within the timeframes that the Act calls for.
I see. We also noticed that there's nothing in the budget to address the market rate change. Regrettably, certainly in my area and many parts of the state, when you went down to the 69th percentile, it really hurt and doesn't reflect the cost of delivery of service. But there's no recognition of the market rate in the budget, and we'd like to see it get back up to the 75th percentile. What's the overall game plan on market rate?
Yes, so the overall game plan on the market rate, Assemblywoman, is that we do plan, and it will be part of the federal plan that we have to submit on March 1st or 31st to the federal government. We do plan on supporting the new market rate effective June 1st, again at 69%. So unfortunately, I think for many of the reasons we just discussed, we're not able to go to 75% as we enjoyed for a number of years, but again, at the 69th percentile, which I would just add is we're probably one of only 3 states left in the country who are able to maintain that level of support for the market rate.
So how can we help you on this federal advocacy specifically?
I think certainly joining with us to have a conversation with the feds, to have a conversation with our congressional, delegation. I think your voices are really important in this conversation. We've done our best to date. We need local departments of social services. We need the advocates. But in your positions as elected officials representing thousands of constituents, families, providers, I think you have an incredibly powerful voice that we'd like to tap in, very soon to really let folks know that without additional support, we're really in a very tough spot.
I'd just like to get your opinion about one other item having to do with the background checks. What's your opinion about requiring that be portable? So when someone has that background check and works for a provider for 2 months and then moves along, that we don't have to keep reinventing the wheel, that it could perhaps stay with them for a period of time. It would, in light of this implementation, probably drive down the cost in the long run.
Yes, I think on principle that makes sense for all the reasons, that you just articulated. Again, the upfront costs of making that happen, particularly having to navigate through the requirement that you have to go across the nation and check any place that the potential provider has lived in the past 5 years, and there's no foundational work that's been done to date by the federal government in creating, those pathways of communication so that we could create the portability of those clearances, because you're right, having to re-clear people time and time again is really not the most efficient way.
Thank you.
You're welcome.
Thank you.
Thank you. We've been joined by Assemblywoman Fahey, Assemblyman Keith Wright, Assemblywoman Mayer.
Thank you, and we've been joined by Senator Tim Kennedy. Again, Acting Commissioner, thank you for being here today. I'd like to piggyback on what the Assemblywoman was saying, because we are very concerned about this $90 million unfunded mandate that's come from the federal government, and as has been pointed out, there's a $10 million allocation put forward by the governor in his executive proposal that covers health and safety inspections. But what's not covered, for example, is the first aid and CPR training, which approximately would cost around $28 million, federal criminal background checks costing $24 million. And so I guess the question is, you've talked about the fact that this is extraordinarily difficult to pull off in the time frame. And if that doesn't happen, do you anticipate that some of those costs or all of those costs would be passed on to the providers? And I have to tell you, I have deep concerns about that. Studies show consistently that in New York State, we have the highest child care costs in the country. We're among the top. And it's already very difficult for families, and we have subsidies, as you pointed out, but it's so difficult for families, and oftentimes they can't afford the child care so that they can go out and work and support themselves. So if there's advocacy and it doesn't work, the question is, what does the state do next? Because I don't see any further allocations that are put forward right now to cover these costs. Would these be passed along to providers?
So I think the first strategy, that we would take is to request in the plan that's due in March to request extensions within the plan that would allow us more time to really, again, when the federal regulations, which have not yet been promulgated, they're asking us to plan and to fund something that is really not fully understood or known because the regulations aren't there. Absent that, Senator, our plan is to request for an extension. As to your question about, passing along fees to providers, we know that is of concern. It's not something that we have historically done, as a state, but this is a historic piece of federal legislation that may take us to conversations in places that we haven't had to go before. But again, I think those are all open, difficult questions that we're going to have to struggle with in the months ahead.
How much does a background check cost?
Well, the SCR clearance check for us is $25. I'm not sure exactly what the full totality, but I believe it would probably be around $100 or a little bit more per provider.
That's what my understanding is. Again, a difficult cost to pass along to providers. Have you examined ways that New York State's statutory and regulatory structure could be amended somehow to give relief to providers?
I'm sorry, Senator.
So, because of this mandate that's on the state, has the department looked at possible statutory or regulatory changes that could be made in order to give, in the context of the federal requirements, to provide relief to the providers in New York State of child care?